Okay. Have you ever wondered what it feels like to not be able to breathe?
Yeah.
My topic that I will be doing today is intubation. Intubation means to establish an airway by inserting an object into the mouth or the nose, into the trachea, which is also known as a windpipe. It is used when someone has respiratory or cardiac arrest, which is otherwise known as a heart attack. It is also used when someone has anaphylactic shock, which is an allergy reaction, or has an airway obstruction due to trauma, otherwise known as an injury, like a car accident or something. Establishing an airway is the first step in the ABC process of resuscitation, which include airway as A, breathing as B, and C as circulation. Intubation is accomplished either orotracheally through the mouth or nasotracheally through the nose using an ET tube. The different ways to intubate may include using an ET tube or a comma tube. Some different equipment used in all intubations may include KY lubricant, which is just to make the tube slick, syringes, and the ambu bag, which is used to ventilate or hyperventilate the patient. Equipment used in the endotracheal intubation also includes a laryngoscope and the blade. Which is used to help visualize the vocal cords. It also has a flashlight on it. An endotracheal tube with a stylet, which is just plastic covered wire. A syringe, and a commercial tube holding device, which holds the tube in place. Equipment used in the combo tube, which is this, include a syringe and the combo tube itself. A nasal intubation may include the endotracheal tube without the stylet. An endotracheal tube can be inserted by a paramedic, an emergency medical technician paramedic, and a combo tube can be inserted by an emergency medical technician, basic, or either intermediate or paramedic. To practice different kinds of intubation, we will be using Fred the Head. That's what its name is. Now we are ready to begin intubation. First, what you do for the endotracheal intubation is hyperventilate the patient, which you can see the lungs moving up and down. And once you are ready to intubate, you tilt the head to the appropriate position. And then you take the laryngoscope and the endotracheal tube, and you insert the laryngoscope into the right side of the mouth, and then move the tongue to the upper left side of the mouth until you grab the epiglottis, which is also, I'll show you from here, which is a little flap. That's what closes when you drink water, so it doesn't go down your stomach, or so it doesn't go down your lungs. You insert the laryngoscope to the right side of the mouth until you find the epiglottis. And then when you lift, you see the vocal cords. which are the round pieces of skin under your epiglottis. And then you lift that up. The endotracheal tube goes down the trachea. Until it reaches a certain point of, on the endotracheal tube, there's markings of 24 and 26. And the teeth, the upper teeth, need to be in the middle of that. You undo the stylet. This is called a pilot ball. That just tells you that on the end of each of the tubes there's like a little balloon. It's called a distal cuff. It just tells you that this is blown up. Use the little syringe, and it's supposed to be in between 6 and 8 cc's or milliliters. You inflate this to 6 to 8 cc's, and then you ventilate. Which what I did there was on this is like this part right here. All I did was took the laryngoscope and took it to the right side and lifted up to the left so you can see the vocal cords. And then the tube goes down your trachea. And the trachea splits off into one lung and the other lung. And it stops about right here. And then when you ventilate, it puts air into the lungs. When inserting the combo tube, again, you ventilate the patient. Ventilate the patient. You tilt the head to the appropriate position. The combo tube is inserted blindly. You don't use the laryngoscope. And there, you can see there's two little lines on the tube, and the top teeth should be in between the two lines or on the top line. The pilot balloon, it tells you on there, this one says 100 milliliters or cc's. Inflate that. It's got a hole in it, so. And the white one is 15 cc's. The combo tube has two different tubes that they hook together right here. There's two different ones. One will be in the stomach and one will be in the lungs. You always start out by ventilating the blue one first. Like I said, it's got a hole in it, but you can kind of see the lungs moving. Or if it's not in the lungs there, you do the clear one, which is in the stomach, which you don't want. And this is it for the combo tube. Also, with using intubation, you can not only give air to the patient, but you can put medications down the tube instead of using an IV, like sticking it in their arm. You put medications down there. It takes longer that way. It takes about 5 to 10 minutes for the medications to start moving all over the body. But for an IV, it only takes about 1 to 2 minutes. Inserting the nasal, you roll the tube up into a little ball, or little circles like this, to form the shape of the nostril. Again, you would hyperventilate the patient. The tube goes down either nostril, it really doesn't matter. And again, it goes into the endotracheal, or the trachea, until about the 26 mark. And again, you would fill the distal cuff with 6 to 8 cc's. Then ventilate them. You would use the nasal for if they would have anaphylactic shock or an allergic reaction, their throat would swell. So you could use the nasal just in case you couldn't get the tube down their throat. Or if they have trauma to their throat or an injury, you can also do that. The commercial tube holding device is used on the oral endotracheal intubation, which is down the throat. This is used just to hold the tube in place. And it also has 2 things going down there to hold the tube in place, and also it's a bite guard, so the person can't bite the tube. That just goes around your neck. And comes up on the other side. Then you put a piece of medical tape around it. You put the medical tape around here. And then ventilate again. Make sure it's still in there. Also so it doesn't move. Intubation is very important to saving lives today, in today's system. Intubation can also be used by giving medications to the patient, which I covered. The Norwalk Fire and Rescue Unit is certified as a conditional paramedic. I think we have 4 or 5 paramedics. And they can use this procedure in saving lives today. I learned how to do this at a training class at the Norwalk Fire Department, which a lady named Joni Cohen, she is a flight nurse for Mercy Air Life at Mercy Hospital, and she is also a paramedic. Maybe someday I can use this by saving somebody's life. Thank you.
Very nice.
Individualization establishes an environment in which students are expected to work alone.